Hello all, I am Dr. Walter, working as an assistant professor in SNS College of Physiotherapy. So it is a warm greeting. I am inviting to my another video. So today we are going to see a new topic, that is Guillain-Barré Syndrome (GBS). This is the most important medical condition which we need to take care a lot. And in other hand, GBS in past, I think so, like 2 months back in Pune and all, it was a greater risk at the area. GBS was most affecting many part of the people and most of them have suffered. GBS is a rare disorder in which it affects the body's immune system. In other hands, we can say GBS is a autoimmune disorder. What is autoimmune disorder? Autoimmune means all of them will be having the immune system in our body. Okay, this immune system is capable of fighting the toxins, other agents which are attacking our particular area. For example, if you are affected with a fever, our immune system will be fighting inside. So these things are most important for our body, immune system management. Now, autoimmune disorder, what will happen in this area? Our own immune system will attack our healthy cells. So this is a tragic event which will lead to death, and which stimulates this autoimmune disorder we'll be learning in the physiology. Now, this immune system attacks the myelin sheath of the peripheral nerves. Myelin sheath. In axons, we are having myelin sheath. What is the physiology function of myelin sheath? It is simple that it transmits the signal from one axon to another axon through the way of dendrites. Okay, so this myelin sheath is working as a saltatory conduction. It is a physiological term which we have learnt already in the physiology class. So this immune system is most important. Okay, this autoimmune disorder, it is affecting the myelin sheath. What will happen if this myelin sheath is getting affected? Myelin sheath is responsible for the sensory and the motor response. Now we are entering into the causes of the GBS. Causes is simple, it is idiopathic. Idiopathic means it is unknown. Anything which can stimulate the autoimmune disorder. Going for the risk factors. What will happen if this GBS is getting affected? Okay, so influenza virus, Epstein-Barr virus and Zika virus, hepatitis A, B, C, HIV, all these things will also induce the Guillain-Barré syndrome. Now we are going for the types. Okay, we are having 4 types of Guillain-Barré syndrome. First one is AIDP, MFS, and next one is AMAN, and next one is AMSAN. 4 types. Now we are going to see what and all affected in these 4 types. Each will be carrying different area of paralysis. Going for AIDP, it will be affecting the lower part and the weakness will be spreaded to the upper region. Going for MFS, it will be affecting the eyes and also to the 5% of people with the GBS in the USA area. Going for the AMAN, it will be affecting particularly people who are staying in the US, and AMSAN will be affecting for the people who are staying in the China and Japan. Okay, so these are about the types. Now going for the next one. Next one is going for the symptoms. What is symptoms? In simple, I'll tell. It is, first one is prickling of the pain onto the foot. Next one, unsteady in walking. People, while they are affected with GPS, they cannot able to walk. They will be going for frequent falls. And next one, difficulty in facial expression. For example, smiling and all these things, angry face, all these things will be going for a difficulty area. Even while we are eating something, swallowing is difficult. And bladder control, controlling of the urinary bladder is impossible. and other things which will be followed in the symptoms. Now going for the next slide, next one will be going for the diagnosis. Diagnosis, most important thing is NCS study, nerve conduction study. As we all discussed earlier, nerve conduction study, it will be placed, the electrode will be placed onto the muscle and will be recorded onto the monitor how the muscle power is working out. Now we are going for the treatment. In treatment, we are going for two techniques. One is IG therapy and plasmapheresis. IG therapy is normally, it is happening in all the areas, that is the antibodies from the donors and transmitted to the givers, that the givers are for going for the people who are getting affected. Plasmapheresis is the exchange of the plasma, and last one is the complications. What are complication? If the patient is affected with GPS, breathing difficulty, they cannot able to breathe while they are walking, they will be losing their stamina, and pain, heart and blood pressure problems, cardiac related problems, BP will be fluctuating, and the blood clots most common into onto the corresponding areas, pressure source and the relapsing. Relapsing means it will be occurring after and after. Now, if we are going for this condition, first and foremost thing, we need to consult for a hospital admission, and corresponding therapies and corresponding treatment are as follows. And students, today we learned something new about Guillain-Barré Syndrome and the causes, complications, diagnosis and the treatment. And we'll meet on to the next video. Bye.